A very good morning to all of us watching us live right here on Lookup Television, and this is the Morning Drift. Remember, the conversation is just but starting. Of course, it's the 1st of April 2025, and by the way, we had actually acknowledged the fact that the awareness was done in the month of March, and indeed so much was done. Earlier on, when we were having the conversation on kidney health, we had embraced, of course, Kasioka, who has been an advocate in the kidney awareness. And by the way, if we are discussing about this, the same situation also applies. Even as we delve on into the matter completely, we'll also have an understanding, and because we've made this awareness known to everyone, and of course the patients and the health ministry, what is supposed to be done, and in understanding the clear context on this disease, what really it is, and what are the treatment methods, I'm involving a doctor who is helping us to shape this entire conversation. It's not the end of this particular awareness, but above all, we'll continue embracing the awareness of kidney health and let the society know about this. This is the Morning Drift. My name is Okech. My director is King Dante Max. Please allow our guest to introduce herself.
Thank you so much. Good morning, everyone. It's a bright morning today.
Indeed, I believe so. It's
Yes.
the 1st of April.
Yes.
How are you doing?
I'm doing well. Should I fool you? Because it's April 4th.
You already fooled me before we got on set.
Okay. My name is Dr. Sharon Ngeno. I'm a medical doctor. I love doing health education to the public, and I'm also an advocate of women's rights and everything that involves educating the public masses.
Indeed.
I'm happy to be here.
Indeed.
I'm happy to share
Of course.
about the kidney.
I believe so.
Yes.
You've mentioned something that perhaps attracted my attention about the human rights. When we have complications, health issues, having difficulties in the health, do you think that is also something to consider in the human rights?
Yes, it is. Access to quality healthcare is a human right and should be given to everyone. Yes.
Do we have that as far as the country is concerned?
I can say yes and no.
All right.
Yes, because the health sector is growing day by day. So there's accessibility to healthcare. The problem now is, are people able to afford the healthcare? Are people able to access the healthcare? By that I mean transportation to the healthcare facilities. Do the healthcare facilities have staff that are able to serve the people who come to the hospitals? Or is it just an empty hall that has no staff?
Indeed.
Yes.
Wow, amazing, and so many is to discuss about the entire health ministry, and to discuss on how the country and the people can get real help as far as their health is concerned.
Yeah.
Today we are having the Morning Drift Health Check. Let's start this conversation in a very in a very friendly way.
Okay.
If you are sick,
Yes.
what are the best ways that you can adjust to make sure that you get treatment? If today you get sick,
What would I do to get treatment?
because there's so many other people that get sick,
Yes.
and the first thing they do is itaisha too.
Oh, okay, yes. For me, the first thing would be, if I feel like I'm not feeling well, I would maybe go to a chemist, and it's a bad habit, and maybe buy what I think could be suitable for me.
that moment.
Yes, and then maybe after some time, if I feel like it's not getting better, now I would go to a healthcare facility or to a hospital.
Indeed.
Yes.
Indeed.
Yes.
And then the last time you were sick, ilichukua time sana.
Maybe because it's biased because I'm a doctor, so
Unajitreat.
yes, but that's a very bad healthy behavior. It's not a very good healthy behavior, because sometimes you might overlook something and take a painkiller, and maybe you had something going on in your body that was maybe severe. Yes.
Which inaenda sasa ikiongezeka.
Yes.
The pain might now come to a real disease with no cure.
Yes, the problem is most of the people go to hospitals because of pain. That's why you find most of these illnesses that kill people
Indeed.
just come suddenly because someone didn't go to the hospital. Yeah, so the health-seeking behaviors in Kenya are a bit wanting. We only go to hospital when we're in pain. Yes.
Because kama kuna pain, you don't.
You just stay at home. Yes.
Right. So the first procedures when I'm sick, because it's health check above all, whatever disease, either headache, either stomachache, the first thing I should do, what would be that?
So ideally, if you're feeling unusual symptoms from your normal health, I would advise you go to our nearest, maybe, right now there are so many facilities, there are dispensaries, there are health centers, there are malls for the people who live in the urban areas, and there are small clinics that have been set up. So I'd advise you to go to an outpatient center and maybe get checked. Yes.
All right, get checked. This is the Drift Health Check right here on Look Up Television. And remember, we are having this particular discussion just for the sake of our viewers across the country, to also help us understand why are we having so many issues related to health problems. And by the way, if you're discussing about this, we are also having the conversation on kidney disease. I believe we've made so much awareness since the month of March started, and we are shifting it to the month of April. I was speaking to a lady who has battled kidney disease for the past 25 years, and this is really traumatizing. I don't know how she handles this, but of course, when I spoke to Dr. Mateko, I don't know if you've heard of her, the patient has really struggled, embracing all the treatment methods, embracing the intakes, the advices from the doctors. It has become a challenging factor to consider in her life. She's also supposed also to join us, of course, in the conversation. But before we get to really understand her story, what are the things to consider as far as the kidney disease is concerned?
I'll take it from there. So we'll start with March is usually our kidney awareness month, as you've said correctly, and we celebrate it on the second Thursday of March. So in this case, for a month, it fell to 13th of March. Yes. So what was our theme for the year? The theme for the year was, are your kidneys okay? Early detection and diagnosis of kidney disease will help in the good outcome.
Indeed.
Yes. So some people will ask, what is a kidney? So kidneys are kidneys are basically organs in the body that help in filtering excess waste from the body and many other functions that they have. So the kidneys are located in the lumbar region, which I would just point is upper pneuma. People usually think the kidneys are at the front, but they're actually at the back, at your lower back, which we call it the lumbar region. So we've talked about the functions of the kidney. So we've said filtering excess waste from the body, which comes out as urine, which everyone knows. But people don't know that the kidney also has other functions. So for this, yes. So the kidney one is useful in formation of blood. So there's a hormone that the kidneys produces that is called erythropoietin that helps in formation of blood. So that's why you'll find most of the kidney patients usually get fatigue because they don't have enough blood being formed. Yes. Another thing that the kidneys does, it basically balances the pH in the body. pH in the body means acid and base. You remember, that's basic science. So it balances the acid and base in the blood so that you don't have an acidic or a very basic environment in your blood. Yes, so it's hemostasis. Yes. So those are the three main functions of the kidneys.
Indeed.
Yes.
You mentioned something about the back, and many of us would have thought that it's found on the
front part.
The front part. So if I'm having pains on the back,
yes,
am I supposed to be curious?
Yes, you should. If you're having, as we all know, the kidney produces urine. So if you're having maybe reduced urine output, or you have some weird symptoms in your urine, maybe your urine has changed color, you're no longer going to the washroom as you used to. Reduced
urine?
Yes, output, meaning on a normal day, you'd go to the washroom how many times? So many times, about 4, 5 to 6 times, depending on your intake of water, But someone who has a kidney disease, you'll find that they've taken the water and everything, but still they're not going to the washroom as much, maybe once or twice, and it's a bit disturbing when you're actually not producing urine. Yes. So those are some of the factors to look out for. Another thing now, you have those factors, then you have pain in your back region, or we call them the loin regions, then that would be a red flag for a kidney problem. So go get checked.
Indeed. For a normal person, taking water, of course, maybe the 8 glasses as we used to say, so how many times am I expected to go to and release urine?
Okay, it's variable from person to person. We've said the intake of water will determine maybe the output.
Indeed.
So you'll find someone doesn't take as much water, so they'll go to the washroom maybe 3 times. Someone else will go maybe every hour. It just depends on your intake of water.
What's the normalcy?
I would say about 3 to 5 times. Yes, average.
Indeed.
Yes.
All right. So we also have the damage of the kidneys.
Yes.
So how are people damaging their kidneys?
Yeah, so now we've talked about the normal kidney and its functions. Now, what is a kidney disease? So chronic kidney disease is when the functioning of the kidney has decreased over a period of time, in which when we say chronic kidney disease, it means the functioning of the kidney has reduced for a span of 3 months.
Indeed.
Like that disease has been there for more than 3 months. Then now the kidney function has gone down. That's when you would say you have a chronic kidney disease. What are some of the signs and symptoms that your patients will come with you to the hospital, like our patient who's we're expecting would say? So the first thing that would maybe most patients first are asymptomatic. So someone who has a kidney disease doesn't know. They just live a normal life, and life continues until now when they start having symptoms of maybe face swelling, lower limb swelling. So someone wakes up one day, their face is puffy, their limbs are swollen. The reason for that is because, remember, we said the kidneys are removing water from the body. So when we have chronic kidney disease, your kidneys are not functioning, so they're not removing enough water, so there's accumulation of water in the body. That's what we call edema. So some edema. Yes, so a patient will come with swelling. Another thing is fatigue. Fatigue. Remember, the kidneys do what? They produce blood through the erythropoietin hormone. So in this case, the kidney is not functioning well. So we are not producing erythropoietin. So the blood levels are low. So when the blood levels are low, you have fatigue, dizziness, laziness. They don't function as normal. They get tired easily. They're not able to walk long distances like they used to before. Yes.
Without mentioning about the kidney, is it also a point to consider when all the signs and symptoms look similar? Maybe it's another disease, not the kidney disease.
Yes. Yeah. So first, I forgot to mention about the risk factors, or what actually causes the kidney diseases. Right. That would answer your question.
Of course.
So the common so I'll start with the statistics in Kenya. About 4 million people are affected with kidney disease in the whole of Kenya, and people don't know that.
Dead.
Yes. So the numbers are increasing day by day. This is because, one, the risk factor for kidney disease, hypertension. So many people are hypertensive right now. I'm sure it's, we can call it an epidemic. Yes, that is because of our lifestyle. Number 2, we have diabetes. Diabetes is a risk factor for kidney disease. Yes. Number 3, we have some chronic heart conditions that people have. Number 4 is obesity. Obesity is a risk factor. How many people exercise? How many people eat healthy? Very few people. Those are the risk factors for kidney diseases. Yes.
But eating healthy right now is becoming a crisis because there's no healthy food.
Yeah. Is it there's no healthy food, or is it the economy? Healthy food is expensive.
Indeed.
And fast food is cheap.
Of course.
And fast food is not healthy. That's the problem.
What about GMO?
Yeah, there's GMO right now, but I believe it's hard to differentiate which one is GMO and which one is not GMO. So I just advise someone, just eat the green leafy vegetables, eat your homemade ugali, eat your homemade mashed potatoes. Yeah, exactly. And it's actually affordable and it's available. Yes.
Most of the time, remember in old times, of course, you were eating ugali and skuma, then you can maintain the entire day without feeding.
Yes.
But right now, if you take the same meal, by at 10 a.m. you feel like you've never taken anything. The meal also is a challenging factor to kidney disease.
Yes.
The intake, perhaps.
Yes.
So what are some of the food that we should take to avoid this?
I would say take to avoid. First, eating healthy. Avoid high cholesterol food. High cholesterol food is the fast food that we enjoy eating. The pizzas, the smochas out there, the mandazis, cakes, chips, and all that. Avoid high cholesterol food. Eat a lot of green leafy vegetables. Eat a lot of fruits. Fruits are available. You can even go seasonal. If it's time for pixies, unakula pixies. Mangoes, I mean.
Really?
Yes, it's available in the local markets. Another thing is hydrate. Hydrate.
Magical.
Yes. Dehydration, you're killing your kidneys. Let's take a lot of water. Water is free. Water is available everywhere.
But I imagine it.
Oh yes, because of the rains, the water would be dirty. But I mean, we did science. If you have dirty water, why don't you boil, filter? Things can be done at home if you're actually intentional, right?
Indeed.
Yes.
Right.
Yes.
So fruits to consider are like mangoes, banana.
Yes.
Chungwa.
Mangoes, bananas, oranges. Those ones are good. And then someone who already has a kidney problem, they'd be advised to eat like high protein diet. Yeah, because remember, when you have a kidney problem, your kidneys are not filtering what they should be filtering, so they are filtering including your proteins that should be absorbed in the body. Yeah, so utambe ukula a lot of chicken, a lot of beef, a lot of the black beans. Yes, those
which is expensive.
It's called njahe. Njahe is expensive.
Yeah, sure.
Yes, there is beans, kawaida. There is green grams, ndengu. Those ones can be eaten. Avoid fatty food. Yes.
But chicken is fat.
Are you fooling me? Broilers.
Oh, right. What about fiber intake?
Yes, high fiber intake is good. That will be in your fruits and in your whole fruits and in your vegetables. Yes.
All right. In the consumption of water and really wanting a big amount or a large amount of water intake in your body, there's something I watch online and say that pia maji mingi inaweza kufanya ngori.
Oh yes. First of all, if you already have, because we're discussing kidney, let me start with the kidney. If you already have a kidney problem and you're taking a lot of water, you can imagine the damage. Yes, you're gonna be filling your body with fluids. So fluids will accumulate in your lungs, will accumulate around your liver. Any cavity in your body will accumulate fluid, which is very, very fateful. You'll have to be in an ICU to get all those drains. Yes, but on a normal day, I usually say about 2 to 3 liters is enough for the body.
Right.
Yes.
Acute kidney injury, that is AKI, a sudden loss of kidney function.
Yes.
If at all now today I lose the function, responsibility of my kidneys, what is it gonna look like?
Okay, so you're asking about how will I diagnose someone who has a kidney problem? Yeah, so for diagnosis, there are usually just 2 tests that we do. There's a blood test, there's a urine test. Maybe we can add some imaging, but for blood test, you're basically testing your urea, creatinine levels, which are the things that are usually filtered when your kidneys do their filtration. Yes, so we are checking, is it a lot or is it little? If it's a lot, it means your kidneys are not working normally. So those are the UECs that is checked in your blood. Then there's the urine. You check your urine output. Remember, we said when you have a kidney problem, your urine output is going to reduce. So in this case, you're going to do a 24-hour monitoring of the urine. If it's less than the normal, if it's less than 80, we say the person has a kidney problem. Yes. That's for diagnosis. Sometimes we can do CT scans. So CT scans will enable us to see the parenchyma of the kidney. What is the structure of the kidney? Has it shrunk? Is there some growth? Is there a cancer? Is there something unusual in the kidneys? That can also help us in diagnosis. Just those 3 things, nothing complicated. Someone would think a kidney ikikuwa na shida, it's a very complicated diagnosis. No, just draw blood, we check, and we're able to diagnose.
After that, how are we able to process the treatment now methods towards this particular patient? Okay,
sawa. So for treatment, remember, most of the causes of kidney disease are hypertension and diabetes. Yes, those are the 2 main causes of kidney disease, especially in Kenya.
There's also family background.
There's a family history that would be, family history of kidney disease. That would be for specific kidney problems like polycystic kidney disease, which is a genetic thing.
So most of the time see at history of family?
No, it's mostly diabetes and hypertension. You won't even believe me, but diabetes and hypertension damages our kidneys. So for that, I'd say if you're diagnosed with diabetes or if you're diagnosed with hypertension, please comply to your medication. Take your medications kama chakula, as you had been told by your doctor. That will protect our kidneys, because now the regimen that you're using for treatment of hypertension and diabetes, there's a specific drug that we give as a combination that really protects our kidneys. Yes, so if you go ahead and just skip the medication, we're killing our kidneys. That's one of the...
Okay, and then the doctor says that this is a family history, and you now need to start activating some other things to
Yes.
do. How do we go about that? How will we feel about that?
Okay, sawa. So we've already seen our patient, we've already diagnosed kidney disease, we've seen if they have hypertension or diabetes and they're okay. Now there are people now who will now need further treatment. That is where dialysis comes in, and renal transplant. So I'd start with dialysis first. So dialysis is basically you're assisting the kidneys to clean the body. Yes. So in this case, there are two types of dialysis. There's hemodialysis, which is common in Kenya, and there's peritoneal dialysis.
Right.
This sounds very complicated, but I'm just going to make it simpler. So for hemodialysis is just basically we are trying to get an artery and a vein in your body where we can insert a catheter, or we can insert something that will be connected to the dialysis machine, so that your damu yenye tunatoa hapo is running through that dialysis machine. So we are trying to filter out the excess waste that the kidneys are not able to do that. So that's hemodialysis. So you'll find most of the people in this country have a catheter, or they have a fistula somewhere on their hand. You'll feel they have a catheter that they use for dialysis. Catheter, yes. Catheter is a tube.
Oh, it's a tube.
Yes, a tube that you insert, that can be inserted inside the vessel.
It's not a vein in the body.
No. A catheter is it's something from outside.
Indeed.
It's a tube that you're going to insert, or you can create a fistula, then you're able to cleanse. So for patients who require dialysis, they need to be at the hospital 2 to 3 times in a week, and for the rest of their life, basically, or until the kidney function has improved. That is if they don't have permanent kidney damage for this case. Yes, so you'll find most people, they'll tell you they're doing dialysis, but they really complain because of the costs. Yes, the costs of dialysis in Kenya is extreme. It costs about 10 to 15,000 per session, and remember you have to do 2 to 3 sessions in a week.
Indeed.
So that one will come to about 45k on the higher or on the lower end. 45k in a week. Who's able to afford 45k in a week? It's hard. Yes. The big people. The big people. And even in the long run, people who have money, it will drain them. It will drain them.
Of course, 45k in a week is really draining.
Yes.
So in 2 weeks you have 90k.
Yeah. In a month.
In a month umesold.
180.
And a savings imepotea.
Yes.
You sell your land, you sell everything.
Yes.
All right. Well, before we take a short break.
Okay.
You mentioned something about dialysis.
Yes.
and the treatment.
Yes.
And of course, taking samples to test this.
Yes.
Are there positions where you found that the blood, despite kidney disease or kidney issues, the blood also indicates so many other promising diseases? So so there are specific tests that we do for the kidney. So when I'm drawing blood, I already know what I'm going to test. But you'll find most of the people who have kidney disease have other underlying conditions. It's very hard to find someone who just has a plain kidney disease or the kidney injury without blaming it to the heart, without blaming it to the somewhere. It could be a tumor somewhere. It could be your liver not working. It could be your lungs not working. Like all those organs in the body can affect the kidneys. Yes. Wow.
Yes.
And the heartbeat?
The heartbeat is still there.
Wow.
If it stops, the kidney stops.
The kidney stops.
Yes.
Oh, amazing.
Yes.
And the only saddest part is how much you're spending.
Yes, the saddest part is how much you're spending. But SHA is able to cover 10,500 per session. So if a session is 15k, SHA is covering for you 10,500.
And you wouldn't forget about SHA.
Yeah, I cannot forget because some people have benefited from that. At the same time, some people have not gotten help.
But earlier on we had kidney patients don't benefit a lot with the SHA. Yes,
they benefit. SHA benefits a lot of kidney, a lot of cancer patients. because you see we've said 45k in a week. So if you're able to save around 30k, it sure has helped you, yeah? But for someone who is spending that whole 45k, they'll feel like, hey, I wish I had that SHA. Right. So SHA would be helpful in that case.
All right.
Yes.
Katheta and Parenkaima, these are the terms of medicine right here at Lookup Television. And of course, this is the Drift Health Check. Don't go too far. We're taking a short break. Taarifa zinapochipuka na kutufikia papa hapa kwenye makao makuu ya chumba cha habari cha runinga ya Lookup, kwenye taifa, kwenye serikali, kwenye bunge, tunajitosa hadi kwenye sauti ya wenyeji ili kupata tu maoni ya wenyeji kuhusu masuala haya yanayochipuka.
Maana hii kitu inaenda kuumiza Mkenya kwa tax.
Hakuna kitu tunafurahia. Nothing. Absolutely nothing.
Sisi tunaumia, si ati tunaumia ile ya kiukweli. Juu maisha ni ngumu.
Na bila shaka tunapata maoni yao ili sauti yao ipate kusikika. Na watasema hili, waseme lile, watasema hiki na waseme kile, almuradi sauti yao ipate taa.
Mambo ya mafuta tena imekuwa ni changamoto zaidi kwa kila mtu wa bodaboda.
Uchumi ikikuwa stable, tunaamini mambo itakuwa sawa sawa.
Kwanza liko na ria wasi wa boda, mama mboga nini. Hao sasa ndio wamefinywa zaidi man.
Mpenzi mtazamaji, hii ni bunge la wenyeji.
Feeling like unwinding and calming your nerves down after a long week? I'm Nika Kala. Join me on the Nakala Report this coming Friday and every Friday at 8 p.m. only on Lookup TV. At Nakala Report, we turn the insanity into sanity and sanity into insanity.
Kipindi ni ukulima ni mali na Manjoro. Kumbuka hapa ndipo unajifunza mambo mengi kuhusu ukulima. Kilimo ni uti wa mgongo wa nchi. Na ukiwa na Njoro unajifunza. Kumbuka, angalia mwenyewe. Tunakuambia ukitaka kujua tips za ukulima, ungana na sisi kwenye Lookup TV. Every Sunday unatukuta pale saa 10, tunakuonesha kuhusu ukulima. Ukulima wa mimea, ukulima wa ng'ombe, ukulima wa kuku, ukulima wa mbuzi na yote ambayo yanahusiana na ukulima. Kumbuka nini? Kipindi ni ukulima ni mali.
Alright, thank you so much, ladies and gentlemen. If you're watching us, this is the Morning Drift and we're just having a conversation on your health check. Do you know someone who knows someone who has kidney disease, kidney failure, and really tries out to find a way on how they can maneuver throughout those? And of course, we are also having so many other diseases. What are the first steps to consider when we are embracing these diseases? Someone that has a headache, someone that has a stomachache, and the end result becomes more worse. When we were starting the conversation with Dr. Ngeno, we needed to understand clearly if I'm sick today, if I'm not feeling well, what are the first steps that I should consider for medication or for treatment. But above all, we're also having the conversation on kidney failure and kidney disease. Before we went for the break, we were just having an insight on how the Social Health Authority has benefited the kidney patients. But we'll dig that in the later conversation. But allow us now to delve kidogo, as you had mentioned, about the dialysis and the entire process on dialysis, since it's a point to consider on the dialysis thing. The intake and the entire environment of dialysis with the patients and letting them understand all this.
So we've said management of kidney disease, it can be dialysis or kidney transplant. So dialysis is what most people in Kenya are able to access and afford. So dialysis is where a patient's blood is basically just cleansed through a specific machine that is called a dialyzer. So in our case, we have two types of dialysis. There's hemodialysis and peritoneal dialysis.
Amazing.
Yes, those are sound difficult, but they're actually easier. I'll make it easier. Yes, so hemodialysis, we said, is where you access the vein and the artery of someone through the veins are usually maybe on the hand. Most of the time, yes. So you insert a catheter, and that catheter now will be connected to the dialyzer machine, and you're able to cleanse and remove the impurities from your body. Remember, we are assisting the kidneys that are not doing their function. Yes, so another type of dialysis is peritoneal dialysis. So peritoneal dialysis is basically we're using the membrane around the peritoneal, which is the stomach region in layman language, this area of your body. Yes, so we are using that. There's usually a membrane there, so that membrane is what we're using to filter out the excess waste from our body. Most of the time, peritoneal dialysis is used for young patients, the small kids who have kidney issues. Remember, kidney issues doesn't just choose the old and the aged people. We have young patients who have kidney issues, and they'll need that dialysis.
So they receive the same dialysis?
Most of the time we do peritoneal dialysis for them. Yes, it's better, it's safer. It's just that there are very few personnel that are trained for peritoneal dialysis compared to hemodialysis, and maybe the affordability of that peritoneal dialysis, it would cost maybe about 100K to 200K. And remember, we were talking about hemodialysis. Hemodialysis, we said you have to do about 2 to 3 times a week. And if you're doing 2 to 3 times a week, remember one session costs you about 10 to 15,000. 10 to 15,000 times 3 per week, that would be 45,000, right? In a month, that would be about 180,000. That is outrageous. Yes. So we have SHA, Social Health Authority.
Before we get to SHA,
yes.
The dialysis is a process.
Yes.
Is a process that will help the kidney patient heal.
Yes.
What if it doesn't?
It doesn't help you to heal. Remember, we're now doing the work of the kidney because our kidneys are not doing its work of filtering excess. So the reason we are going for dialysis is to remove the excess waste from the body, because if they accumulate, everything is going to die. We're going to have a very acidic environment, or other organs are going to die. So that's why dialysis is like a lifelong treatment. If you're not able to get a new kidney, you just have to keep doing dialysis.
A new kidney means the donation?
Means now the transplant.
The transplant?
Yes.
So that's the other time we have donation?
Donation is kupeana. So a donor is someone who's giving you the kidney. But the process is called...
The transplant is now removing
the process is kidney transplant. The process of removing a healthy kidney from a donor to a recipient.
That's the transplant? That's
now the kidney transplant.
Hey, so the transplant doesn't work, the dialysis doesn't work?
No. The dialysis is not treating us. We are just basically helping the kidneys remove the waste. Yeah? And this is, remember we are talking about a patient who has a chronic kidney disease, meaning kidney zako zimeacha kufanya. So unahitaji kusaidika kutoa. So what are we going to do? We are going to do the dialysis. But if, yes,
then the kidney will get back to normal?
Not really. Your kidneys are not working anymore. So what are we going to do to assist? Remember, the kidney just filters excess waste from the body, helps us in formation of blood, helps us in balancing pH in the body. So kama kidney zako hazifanyi, there's a way that you can remove that waste from the body. You're getting it now?
I'm getting it.
Yes. So how are we removing that waste from the body now that our kidneys zimekata? Tunafanya dialysis. So dialysis is now what we're gonna do when our kidneys have stopped filtering the excess waste. Yeah. But remember, the dialysis has you can have something that can now permanently now sort your kidneys. What you were talking about, can you heal completely? Yes. So now, how do we, if someone is maybe dialysis is become costly and maybe they're able to access a transplant, they have the money, because a transplant is very expensive. it costs about let's say 2.5 million and above, depending on the facility. Yes. So if you're able to get a donor in this case would be someone who's healthy, above 18 years old, does not have any chronic illnesses, and matches with your blood and your tissue type. So it can be someone maybe from your family, or it can be someone outside who has the same blood type as you and is a healthy person. They give you a healthy kidney. That healthy kidney will replace your lost kidney, the kidney that has stopped functioning. Remember, our body has two kidneys, left and right. Thankfully, most of the organs in the body are two. So the bad kidney is removed, they put the new kidney, and life continues, and you've healed from your kidney issue. That is if you do a kidney transplant.
But the failing now is bad.
Yes, that will be now.
I'm thinking about the failure part of it.
Failure of the transplant.
For the transplant and the entire environment.
Yes.
You've done dialysis, which is, we've said is to help just help release waste.
Yes.
And of course we're having the transplant, you know. Then all this, because the kidneys have lost their function.
Yes.
They can't work without the dialysis. They can't work. Lazima tuingize other things.
Yes.
Then the entire process fails.
Fails to mean what? Because it's
fails to mean that everything goes wrong.
It's hard for everything to go wrong during dialysis, unless now there are other underlying conditions that are maybe killing your other organs. But for our case, if it's the kidneys, the dialysis can never fail. It's just, are you able to afford? Are you able to access dialysis? Do you have the catheter? That is the most important. If you don't have an access to the catheter, let's say your vessels are collapsing, that would be now another complication that we'd have, and it would be very hectic. But if you have your blood, we have an access to your blood, and you're able to afford dialysis, and you're able to access, meaning you're able to go to the hospital, and you're able to get the money to pay for it, you're good to go.
Are there situations where the two kidneys lose their functions? Or basically most of the time it's only one kidney that has a problem?
Most of the time it's one kidney, unless you have a genetic condition where both kidneys are affected. That let's say the polycystic kidney disease, which is a genetic mutation, that one now you'd have maybe both kidneys are affected. But most of the time it's one kidney that stops functioning, and maybe if you don't seek treatment and maybe you didn't have the signs and symptoms that are very specific to kidney, now your other kidney also starts straining and lose its function. Now that would be a very bad situation. But most of the time it's just one kidney that fails. That's why you're able to do dialysis, and you're able also to do a transplant, because it's just one kidney. And someone can survive with one kidney, by the way. Did you know that?
Yeah, of course I did.
Yes.
and we also having the part here that because you're having this particular problem, does it also affect the reproductive system?
Not really. It does not, unless you have now something else that is affecting your reproductive system. Remember, the kidneys and the urethra and the bladder is a whole total different system from now your ovaries, or if for the male it's just the penis has the urethra inside, but that's a whole system from the reproductive organ. Yes, so it cannot affect your fertility, it cannot affect the number of babies you'll have. It's just a total different.
So it affects the heart because of the transport of blood.
So yeah, the blood, the cardiac output. Remember, your heart is pumping blood, and the blood has been produced by the kidneys, and the blood is being filtered by the kidneys. So it's a connected system. Yes.
What are some of the things that I can't do when I having a kidney problem?
Yeah, so that is actually something to discuss, because many people have kidney issues. You'll find most people who have kidney issues have stopped going to work, have stopped doing their normal functioning, and this is because kidney issue, when you get the kidney problem, it becomes a burden. You have fatigue, you're fatigued throughout. Remember, the kidneys were forming blood, and now your kidneys are not forming enough blood, so you just have to be on, either you get transfusions, you have to take hematinics to boost your blood, and so you're fatigued. And if you're doing 8 to 5, you'll now be feeling like 8 to 1 is a long time. Wow. So you'll find most of these people will just end up just deteriorating and leaving work. And then remember also, you need to work to earn that money to pay for the dialysis. So it's actually a challenge. That's a challenge that is there.
The only person that can sponsor that.
Yes, that is the problem. But luckily for the people who are able to access insurance is really helpful for patients who have kidney disease. Most of the insurances will cater for your admissions and your dialysis sessions, and you will be sorted for a period of time without doing your out-of-pocket payments. Yes. So I feel like accessibility to insurance is a very good thing to a healthy nation. It's actually it's a positive impact to a healthy nation.
Health insurance.
Yes, health insurance, a functioning health insurance.
All right. Okay. So that means even as we have the conversation on Social Health Authority and the introduction to all of this, how can the Ministry of Health come in handy to support the kidney patients? And we've had so many hospitals out there that I also want to come and support. But of course, we had discussed about the budget for the health is so much high.
Yes.
How will the Ministry of Health come in handy to do that?
Okay, so the Ministry of Health, one, we'd ask them to help SHA to just cover dialysis costs fully. That would be a very good progression in terms of curbing kidney diseases. Yes, it's currently covering about 10,500 a session. So maybe you'd have saved about 10,500 out-of-pocket payments, which is good for someone who has a chronic illness. Someone is helping you pay, so a burden is off you. Yes. Another thing that we'd urge the ministry to do is to create dialysis centers in most of the hospitals. You'd find most of the level 4 and 5 hospitals are supposed to be having dialysis, or they have a dialysis unit, but they don't have trained staff. So I don't know how the ministry is going to try and allocate funds to train personnel to go and to come and work in the kidney dialysis centers, because you'll find a hospital is well immaculate with all the services, but dialysis, it's a slow thing in the hospital. But that is now for the government hospitals. So we'd urge the ministry to just come and try and maybe train personnel, maybe increase the number of dialysis centers so that people don't have to travel long distances to come and get the treatment. Yes, another thing that we'd urge the ministry to do is maybe to provide maybe the care groups and support groups for there's a kidney, I'm sure there are associations in Kenya that support maybe the kidney patients and all that. Such associations are usually good because they enable the patient to keep going. Remember, sometimes the body is not just a machine. There's the emotional bit of it, of a human body. So you'll need that part to enable you to keep going, and even to encourage the patients to take dawahs and to come for dialysis. You'll find someone has been told they have a kidney issue and they choose when to come for dialysis and when not, because they're not motivated. They lost hope. They feel like, if my kidneys are not working, see, I just lose hope. But don't lose hope. Remember, we've said we can save these kidneys by dialysis. We can save these kidneys by before getting the disease. We can save it by eating healthy and doing all those things. So yeah, we'd ask the ministry to support us in psychosocial support.
And do you have a good percentage of those people that have been saved
from kidney issues? Yes, there's a I would say I've worked in the private and public. So in the private sector, I've seen people who've come to the hospital for kidney transplants and people who have been on lifelong dialysis, and they're doing so well. So I'd tell you some facilities, or these dialysis and transplant facilities, have really helped some patients. There are very many patients. If you watched news on the World Health, Kidney Day, which was about 2 weeks ago, most of the stations were airing patients who have talked about transplant. There were patients who were talking about how they're going on with dialysis, and they look like they're normal and healthy. So there's a very huge percentage of people who have, I don't have the exact figures, but there are a number of people who've been saved and helped by the dialysis and the transplant.
Yes, I'm saved today. So what are the precautions that I should have in embracing that particular change? Okay,
sawa. So number one, there are usually some simple rules to life that each one of us usually adhere to. They say the 8 or 6. I'll talk about maybe the 4. So eating healthy, exercising. How many people exercise in a day?
Still COVID, many people.
No, actually, they were bored. But imagine you need to exercise at least in a day, at least 30 minutes to an hour in a day. So So eating healthy, exercising, we talk about specific foods that you should avoid. So avoid the fatty food, high cholesterol food. We're supposed to avoid that. Another thing that we do is early detection, which would mean that in case you have a small symptom, please go and get checked. If you have hypertension and diabetes, take your medications daily. They're going to protect the kidneys. And with all that, our kidneys are going to be healthy, and we're going to be healthy people. We're going to save that 180K in a month by protecting our kidneys. Yes.
So we're having a budget of probably 200,000 for all this treatment.
Yes.
You had mentioned about SHA. So if SHA is coming in for the entire helping hand to cut the cost, how will we deal with that in the context of really understanding it, stuff in as an idea, and also all the entire amount that I'm supposed to put in place, it at least sliced.
We've talked about SHA covering about 10K in a per session. So that's about 30K you've saved in a week. That's about how much in a month? About 120K. So you've saved 120K, meaning it has lifted a burden from you that should have. That 120K is going to be saved. So what would you advise people? I'd advise people, please register for SHA. Even though SHA is not working in specific areas, I know the Kenyatta and the big hospitals have the 5 referral hospitals in Kenya have the SHA functioning in their hospital. There's Moi Teaching Referral, we have KNH, we have Meru, we have Kisii, we have Nakuru. SHA should be able to cover for dialysis. I've not heard anyone complaining that SHA was not able to cover for that 10.5 that I'm talking about. Yeah, so I'd urge people to maybe get their SHA, register for the SHA, and at the same time, if you're able to afford insurance, please get your health insurance. Health insurance has really protected many people from selling a lot of land to cover the cost of healthcare. Yes.
All right, so kidney disease is a growing health concern globally and in Kenya, with thousands of patients requiring either dialysis or a kidney transplant. Despite transplant being a more permanent solution, most patients opt for dialysis. Kidney occurs when the kidney lose their ability to filter waste and excess fluids from the blood. It is classified into 2 types, what we mentioned earlier. So we've all known about this. We've embraced this. Now, of course, if the listener had this particular problem, already knows the situation.
Yes.
Then we've learnt about the entire processes of the dialysis and the treatment.
Yes.
So what's the take home when now you receive a patient and has this particular problem? How would the society embrace them? The closest friend, the family, and above all the doctors, the hospital, how will they embrace these particular patients?
Okay, sawa. So I'll start from home, family. How will you support the patient? So number 1, encourage them to take the medication. Encourage them to come for dialysis. You know, when there's someone in the house who's responsible for a patient, they're able to tell you on Wednesday, Kenyatta. Yeah, so family support is very important. Number 2, where you work, in your work setup, are you able to tell your employer that you have a kidney disease? Are they able to give you off days to go for your dialysis sessions? Are they able to relieve you from heavy duties? Because remember, patients have fatigue. That's another support that we would get from work. Then another thing would be maybe the government now, in this case, just enable the SHA to be functioning, maybe to increase the amount that it covers for the dialysis patient, maybe reduce or maybe make the kidney transplant affordable in Kenya by maybe increasing the facilities that are able to do kidney transplants and training more personnel on kidney transplantation. That would really be helpful in assisting a patient who has a kidney problem at all.
Indeed.
Yes.
As a doctor now, I want to give you time now, because we are ending the show now.
Okay.
You advise these particular patients.
Okay.
And of course advise the doctors as well.
Okay.
Then make sure that we have a standard way to approach all the kidney patients.
Yeah. Sawa. So I'd urge our people at home who are watching us, and maybe you feel like you have some symptoms that we've talked about that would be a red flag to a kidney issue. Please just go to the nearest facility, get checked. Remember, we say the checks are very easy. We're just doing blood work and we're doing urine. That's it. So that would be very important. If you get any red flag, please go to hospital. Another thing that we do is, remember, exercising, healthy diet, We are trying to curb cholesterol. Remember, obesity is one of the causes of kidney issues. So let's try to remain a healthy nation. Healthy nation, healthy people. We're going to have healthy kidneys, and you're going to be happy people. Yes.
Indeed.
Yes, for our doctors, I just urge us to be maybe more keen on picking up patients who are at a risk of getting kidney issues, and our doctors are doing so well in that case. That's why we have many patients going through dialysis and not dying of kidney problems. Yes.
You know, when we speak about matters health, it's so bad. It's so actually traumatizing.
Yes.
You listen to these stories, you listen to this analysis, then you also remember that apart from kidney issues, there's also a variety, so many other diseases that come forth.
Yes.
From where you see it, that is now aside kidney stories.
Yes.
Why don't we speak about immunodeficiencies, the HIV so much nowadays? The times that this disease was like the cancer thing.
Yeah. So I think, why don't we speak about it? One is because maybe right now there's accessibility to ARVs. So when people are able to access ARVs and they're able to get managed, you're not able to pick out ule mtu anakaa kwa mgonjwa, you know, because people look healthy because they're taking their ARVs. But also there's something about this enlightening of the nation. There are so many campaigns that have been done. There are so many campaigns about HIV. We've done those trusts, condom advertisements that we've seen. With us school educations, you find most of the schools during break they'll have someone who will come and teach them about HIV. That has really helped the nation. Na pia kuogopa sasa unasikia ati it's a lifelong thing, you cannot heal.
Really.
Yes.
Should that apply to all the other diseases, the campaigns?
Yes, it does. That's why we have every month there's something we're celebrating. Those are campaigns that make the people aware that these things are there and this is what can be done. You know, sometimes people in the village, they get diagnosed of this thing. They feel like it's the end of the world. They don't know that you can actually get something that can help you. Yes. So the campaigns will reach out to the people, masses everywhere, the rich, the poor, the people who are struggling, the young, the students, and the old.
The campaigns should never stop.
They should never stop. Health campaigns, health education, what we are doing right now, this is good. It's reaching many people.
Right, with only one word.
Yes.
If kichwa chako kikinyolewa, kichwa cha jirani kikinyolewa,
chako kitie maji.
You've seen someone in the at home, in the streets, or in the society that is sick, and you are healthy. Instead of showing off that hey manze nini, how will you approach them?
If you saw someone who was sick and they needed help,
any disease, and maybe they needed help, instead of saying ni wagonjwa.
Oh yeah, so on a more personal level maybe. I feel like sometimes it goes overboard, because anytime I'm anywhere and I feel like I see someone who's sick, I would always be willing to go and ask them what's going on, listen, and you end up just carrying so many burdens. Yes. But if you're able to help, why not?
Right.
So I don't feel like it's taking anything away from me.
Right. If you want to get advices or awareness from Dr. Ngeno, how should we get in touch?
Oh yes, you can follow me on my socials. On my Instagram as Dr. Sharon Ngeno. On my LinkedIn, I'm Dr. Sharon Ngeno. On my Twitter, Shazi Ngeno. And yes, let's interact.
Right, let's interact, of course. Thank you so much, Shazi. I was saying Ngeno every time. It's Ngeno.
It's Ngeno, but now without how we write it without an apostrophe.
So it's Ngeno.
Yes.
All right, thank you so much. Those are lovely touches, of course, in the empowerment and the awareness of kidney disease and the kidney issues. So we are ending the show, of course, despite the advantages of transplants. Many Kenyan patients prefer dialysis, and one of the reasons for this trend is limited access to transplant, but also cost, or the cost barriers. That is why we were engaging about the SHA thing, and of course misconception about kidney disease and transplant still persists. Of course, we are also having a number of or a very bad percentage of the kidney patients right in the country, and I can imagine of the 25 years battling kidney disease, we'll get a more engaging conversation with the patient to really understand how she battled this particular disease. But above all, we still have embraced the awareness. This is the 1st of April. Let's now shift gears to another particular engagement, and the campaign still continues. This is the Drift Health Check right here on the Morning Drift. My name is Moses Okech. Don't go too far. This is the only station we are in. Asante Sharon Ngeno. All right.
We value you.